Spider and varicose veins are common conditions that affect many adults. Most of the time they are simply cosmetic, but some of the time there could be a more serious health issue involved.
Joining us to give us all the details on the causes, symptoms, and treatment is one of California's top-rated vein doctors, Dr. Albert Malvehy, otherwise known as Dr. Vein Eraser. Good morning.
Good morning to you. Thanks for having me.
Good to have you. We were peppering you with questions in the break, but the idea of varicose veins and spider veins, and what is the difference between them? Not everybody knows.
Sure. This is a big source of confusion among not just patients, but also physicians. So spider veins are typically smaller than a millimeter. They're only within the surface of the skin. They're within the skin layer.
Like what we're seeing right there.
And, yeah, absolutely. And those are cosmetic, okay? Varicose veins are larger, bulging veins. They usually have a little bit of a 3D appearance, and they're going to usually be on the lower legs where they're sticking out. I think there's some pictures coming up now.
So these are varicose veins.
Those are varicose veins, exactly. They're thicker, bulging veins, and they come from deeper in the circulation, and they're a sign that the circulation is not normal. So that is a sign that blood is pooling in that area. It's not circulating properly, and obviously that can cause trouble.
And is that the cause of that, and what is the cause of spider veins?
Spider veins, you know, the cause of both of them is actually genetics. So I tell patients, show me your parents' legs and I'll show you yours. So 90% of people who have varicose veins, their parents had varicose veins, 10% just bad luck.
What about, I'm sorry, I was going to say, what about standing too long?
Sure, so there are things that can make it worse, okay, but you have to have a predisposition to the conditions, and that's true for spider veins or it's true for varicose veins. So things like being overweight, standing for long periods of time. So we have lots of patients who are surgeons, nurses, police officers, postal workers, people who are on their feet, retail, restaurant workers. Those are things where they're standing for long periods of time will absolutely make them come out more.
So for varicose veins, when do you know that it could be a more serious issue?
Sure. So I would liken this to moles for a dermatologist. So, you know, some moles are removed for cosmetic reasons, and some moles may be precancerous, okay? It's not the patient's job to know the difference. Their job is to say, you know, I sort of have this thing, I need a professional to check it out. And that's where they should be coming to a physician who's a specialist in vein disease. But varicose veins, certainly if you see bulging veins in the lower leg, it's worth it just to get them checked out anyway. But if they're painful, if they're cramping, and certainly if there's skin discoloration, and even if you have skin discoloration without visible varicose veins, so skin discoloration where the skin is becoming dark or leathery between the calf and the ankle, that's a sign that there could be a serious vein problem, but it's just not at the skin surface, so we can't see it without doing an ultrasound in the office.
And what about for pregnant women who sometimes get varicose veins? What should they do?
Absolutely, and I'm glad you brought up pregnant women because this is my #1 sort of pet peeve question. There's this dogma that women should go through all their pregnancies first and then fix their veins. And that is the worst advice ever. It's sort of like telling women, you shouldn't lose any weight in between your 3 pregnancies and then try and lose 100 pounds after the 3rd. It makes no sense. So if they have a problem during pregnancy, they should work with their OBGYN or with their doctor and maybe wear compression socks if they need them during pregnancy. But then afterwards, with an ultrasound, we can usually identify the root defect of their varicose veins and treat it. And if we treat that root defect of varicose veins for 19 out of 20 patients, they're fixed. And they may be fixed for life. So spider veins are a little bit different where they're sort of like wrinkles and they require some maintenance. So every 2, 3, 5 years, they need a little bit of a touch-up.
Okay, so talking about spider veins, not a health risk, but you know, for a lot of women and some men have spider veins too. You feel self-conscious, you know, you notice it. There is now a procedure, it's called vein erasing, and you say it is easy, there's no downtime, it's not painful.
So when people think about vein disease, they still think about things like vein stripping for varicose veins, and they think of saline injections.
And here's some before and afters, by the way.
For spider veins.
Wow.
And saline injections are literally putting salt into a wound. It is really uncomfortable, painful. So now we have FDA-approved medication by the name of Escalera. This medication comes in a vial, it's a liquid, and it can be delivered, injected as a liquid or as a foam. And what's nice about it, it's really gentle. It's really versatile, so we can treat larger veins, even some varicose veins. So with one vial, we can usually cover even a patient's entire leg, sort of depending on the person. It's a few $100s for a single treatment. Treatment lasts about 20 or 30 minutes. Patients feel the little pinch, but the medication doesn't sting or burn. And invariably, when they sort of hop off the table, they're like, wow, that wasn't as bad as I thought it was going to be, and I wish I had done this sort of 3 years ago.
Wow.
So
Really interesting. For more information on Dr. Malvehy, you can go to drveineraser.com, or you can follow him on Instagram at Dr. Vein Eraser. Thank you so much.
Thank you.
Thank you.
Thank you for having me.